Hi there, everyone. I'm going to talk to you today about problems with your feet relating to diabetes. A lot of diabetics might need a procedure called foot ulcer debridement. It's a very big word. I haven't even bothered to write it out there, but it basically means the doctor or health professional is going to get in there and they're going to be slicing away at some issues at the end of your feet because you've got infections or ulcers happening. The question is, why do people with diabetes have feet issues? There's a whole heap of reasons. Obviously, diabetes affects the circulatory system because you've got too much sugar in your blood, and that causes all sorts of issues. One of the issues is it affects your nervous system, and all this yellow network here is the nerves that run throughout your body. And so if you're having problems with your feet, maybe you cut your foot, maybe you cut your toes, if the diabetes is reducing the effectiveness of your nervous system, you're not getting those signals back to your head saying, oh, my foot's bleeding or my foot's cut or there are problems with my feet. And because you're not getting that, things are going on unnoticed. And that can be a bit of a problem. There's some other reasons as well. If we bring in the arteries and the veins, I'm going to take away the nerves just to make things a little bit more simple. So the red pipes here that are coming along, that is blood with oxygen. The blue pipes that is blood without oxygen that's heading back to the heart, and you can just see how small these pipes are at the foot. I mean, they're just so tiny, and you can just imagine how hard it is for the body to get the blood all the way down through these tiny little pipes to the end of your feet. And that's why at the end of your feet, that will probably be where all the problems start happening with diabetes, because the body's just struggling to get the blood all the way out there because it's actually needs to be under really good pressure, and diabetics have circulatory and cardiovascular systems that are not working so well, and so this circulation to the ends of the feet starts to drop off. All right, it starts to not work so well. So that's one reason. The other reason is, of course, the blood's coming down with gravity and also pressure from the heart, but it's got to go back differently. It's got to go back with muscle pressure. And if we bring the muscles into the situation here, we can see that there's lots of muscles here to squeeze on those veins to get the blood back to the heart. But when we come to here, there's, apart from the muscles underneath there, which you can see, there's not a lot of muscles here to be actually squeezing on these blue pipes to get that blue deoxygenated blood back. So the problem can be is the body just starts with diabetes because the circulatory system is compromised. The body's having a lot of trouble getting blood to the ends of the feet and also getting blood away, which means that it can't it's having trouble getting oxygen and nutrients to the foot and taking away the waste products. And so I guess the toes can end up being like a bit of a trash can because the body's having a lot of difficulty taking out that trash and processing it and keeping the body healthy. So problems start to happen with the feet. That's why your doctor wants to come in and cut issues that are forming for you. The best thing you can do, of course, as a diabetic is to move these muscles. And the best way, of course, to do that is to walk. Walk as much as you can on a regular basis, get those steps up. That is going to cause that pressure here, which is going to help you to move that deoxygenated blood out there and all of those waste products and keep your feet nice and healthy.